have to get your hormones tested before you start hormone replacement therapy? And the answer is no. You don't have to in most situations. So especially if you're postmenopausal, you haven't had a period in at least 12 months or maybe even longer, if we want to test your hormones, specifically estradiol or progesterone, we know those hormones are going to be low. That's just how the menopause transition works. If you are premenopausal, perimenopausal, especially like maybe you're starting to have irregular menstrual cycles, you are starting to have some symptoms of perimenopause or menopause, hot flashes, things of that nature, then we can assume that your estrogen levels are in flux. In which case, testing isn't really going to be that particularly useful because it's just going to be a snapshot in time. And so we might glean some information about progesterone in that situation, and it might be useful, but it's not critical. I would absolutely start somebody on hormone replacement therapy in perimenopause or menopause without hormone testing. There are situations in premenopause where you're not sure if somebody's in the perimenopausal transition, where we might want to look at estradiol, progesterone, see if they have some premature ovarian failure, and that can be gleaned from estradiol, progesterone. We can also look at LH, FSH, or AMH, and those could be clues that menopause might be coming on a little bit sooner than they anticipated, especially if they're having some symptoms of perimenopause, but it seems a little bit early for that. So those are situations where we might want to test. When it comes to testosterone, we always test before we use any testosterone. And so we would want somebody to have symptoms of low testosterone, but if we were to consider using testosterone, we'd want to get some baseline levels, make sure it's also low before we considered using testosterone. We might also want to do some testing after initiating hormone replacement therapy, especially for testosterone. It's not as essential for estradiol and progesterone, although sometimes we can get some information in terms of like if levels haven't changed at all with any of those hormones, then especially estradiol, then we might be able to go up on that dose. So hope this helps you understand testing in hormone replacement therapy a little bit better.